Today, I'm pleased to be here in bite-sized conversation with Dr. Hamid Montakab, a world-renowned authority in the field of sleep and dreams. Hello, Hamid.
Hello, Kevin.
We've had a question in from one of our social media followers, Zeno Gazawi. I hope that I pronounced that correctly. He's asked, is there a difference between insomnia due to psychological conditions or insomnia due to physiological conditions? And would you take a different approach to resolve this same symptom, the symptom of insomnia?
Well, actually, insomnia is a very large topic. It involves many patterns, very often overlapping patterns. And as we call physiological insomnia will probably represent the insomnia due to disharmony of the five substances, what we basically will be mentioning blood deficiency or blood pathologies, whereas psychological psychological causes will be disrupting very often the dreams. And we know that the very important aspect of sleep is dreaming. There's two phases of sleep. Most important for health is deep sleep and the dreaming phase. And through dreams, we are evacuating a lot of retained pathogenic factors, as well as many suppressed emotional factors. The dream scenario is actually helping to bring these issues out and to deal with them. So yes, I would say that physiological disturbances probably will be more affecting deep sleep, and that psychological issues will more affect the qualities of the dreams and therefore maybe disrupt the sleep through their intensity or the emotions that they bring up.
Thank you, Hamid. Now, we've had another question that's come in from another social media follower, Fernanda. And Fernanda has asked, are there any underlying reasons why we should be dreaming of water?
Well, actually, it's very interesting because all the ancient classics, both the Neijing Suwen and the Ling Shu, have chapters analyzing the significance of particular dreams. Now, water dreams or dreams with themes of water are related to the kidneys. They might represent pathogenic factors from outside with kidney deficiency. But they also might represent basically the kidneys' weakness and maybe even issues related with some emotions. The main point is, what is the situation of the dreamer in relation to the water? Are they in the water or are they observing the water? When they are in the water, is the feeling a feeling of fear, they're drowning, or they are having pleasure in swimming? Is the water cold or warm? So the most important is when the person wakes up from this dream, what is the remaining emotion, what is the taste that they bring from that dream? And in Chinese medicine, we actually use the dreams to monitor the progression of the treatments in terms of if the dream comes back, how has it changed in relation to the dreamer?
That's fascinating, Hamid. Thank you. Finally, do you have any advice for patients who have trouble sleeping?
Well, the sleeping issues are now increasing. They have practically touched about 30 to 40% of the population, and very disturbingly, a large population of children. And obviously, we can say that they are directly sort of responding to our lifestyle and the changes that the modern world has brought about. We can see that sleep difficulties, if we look on the world map, are concentrating on areas which are more industrialized. and therefore they have a direct relation to what that means. Obviously, light pollution, noise pollution, air pollution, etc. And so what we can say in general is that there are multiple factors which are involved. But one factor which I find, which is probably constant both in adults and in children, is the light factor. Now we know that the sleeping rhythm is set on by the diminishing of the natural light of the day. The the suprachiasmatic nucleus is stimulating the production of melatonin, which is the sleep hormone. Now, if we are exposed to bright light shortly before our sleep time, the sleep cycle is disturbed and will set later. This happens to most of children now who are working on either watching television or working on computers and tablets, even in bed, which means that it disrupts their whole sleep cycle. So I would say just rough advice is reducing exposure to bright sources, bright light, and especially to computer screens.
Thanks, Hamid. What an absolute pleasure. Thank you so much for joining us. Thank you.
Thank you. Welcome.